What's new?
There are so many exciting new treatments. And so there are two drugs. One was fairly controversial, called aducanumab or Aduhelm, and it removes amyloid plaque, sort of the medium-sized clumps, the fibrils.
And so is this a biologic?
Yes, it is a biologic. It is a monoclonal antibody. So basically,
monoclonal antibody.
Yes, sir.
So that's an antibody that's made directed against that protein that we want to get rid of.
Yes, it is. And it's like an immunization. So with the first drug, it was pretty controversial because it looked like it was mediocre at best in terms of efficacy. However, it opened the door for future drugs. So we do have some patients, a few patients taking that drug, but we're really excited about the second drug that just got full FDA approval, lecanemab or Leqembi.
Lecanemab. So that sounds again like a biologic.
Yes, yeah, it's another biologic, again, targeting Alzheimer's plaque, but this time it's targeting pieces of plaque that are a little bit smaller, the protofibrils. So that's a fancy name of saying that smaller chunks that are already toxic to the brain. And so by clearing those, you don't get bigger pieces, and then ultimately you don't get the large amyloid plaques.
And if we do that early, we can maybe, just maybe, prevent Alzheimer's or a type of dementia from occurring?
Well, we slow the disease, about 27% slowing, which is amazing because what do we care about the most? Quality time with our friends, our family, with our occupation, and those are the most important things. What our brain looks like, well, nobody really cares.
That's right.
But can we put the brakes on the disease long enough that we can get yet another drug? Think about it like the nascent cancer treatments. Those first cancer treatments, they weren't perfect. These drugs aren't perfect, but they offered real hope, and I do believe that these drugs offer real hope.
So the hope that we've got is the patients can live a semi-normal or normal to everybody else and still have a little bit of the abnormal proteins. Is that correct?
So if we remove a lot of the amyloid plaque, the hope is that we slow down the second protein from accumulating, which is the tau or the tangles. So we still don't have a great treatment for that. We'll get there. Think of these drugs as chemo for the brain. They are IV infusions, so it is pretty cumbersome.
What do you mean by cumbersome? If I could get rid of these abnormal proteins by coming in and getting an intravenous treatment, I'd be running there as fast as I could just to get into put my arm out of the door of your office.
Well, there are side effects. One of the side effects can be brain bleeds, some brain swelling, or a stroke. So you have to be pretty selective as to the type of patient. So if somebody is on a blood thinner, that's not good. Or if somebody has a pacemaker, it's going to be hard to do MRIs. You have to do a lot of MRIs. And for some patients, that's not affordable, or lots of individuals are unable to tolerate an MRI, but you have to have an MRI frequently. So that's the downside of the drug.
So that could be an expense, or it could be, is that covered by insurance? Usually, mostly, well, depends on the patient?
So far, if you have Medicare, a lot of it is covered as long as you're the appropriate candidate. You have to check the boxes. You have to be healthy. So remember, age does not predict health. Age is heterogeneous, meaning we all age differently. So you could have someone who's 80 and is healthier than a 50-year-old. So you can't look at someone's biologic age. You have to see how that individual functions.